Good morning everyone. I am Malathi, Assistant Professor Child Health Nursing, E.S College of Nursing, Villupuram. Today we are going to discuss about the essential newborn care. What is mean by newborn in the sense if the babies comes under by the 38 to 40 weeks of delivery, or if the babies after birth have to cry immediately. If the babies goes for the normal adapted to the external environment situation is called as a normal newborn. In the sense, first we have to see about the what is meant by essential newborn care. The newborn care in the sense essential care of the normal healthy neonates can be best provided by the mothers under supervision of the nursing personnel or basic primary health care providers. About 80% of the newborn babies should be kept with their mothers rather than in a separate nursery. And the healthy newborn in the sense, I already said first, a healthy infant born at term between the 38 to 42 weeks should have an average birth weight, cries immediately after birth, and establish the independent rhythmic and respiration, and quickly adapt to the changed environment. That is called as healthy newborn. The immediate newborn care in the sense that you have to provide by the main 5 basic care have to provided by the immediately after deliver the baby. First you have to maintain by the temperature and establishment of open airway and circulation, and identification of newborn, and vitamin K injection have to administer for have to control the anticoagulant, and initiation of the breastfeeding have to advised by the mother within a half an hour. Next we have to see one by one. The first one is maintenance of the temperature. The immediate dry the infant under the radiant warmer. They have to followed by the skin to skin contact with the mother. Keep neonate head covered and rooming in. If the baby comes under by the 24 hours, rooming in and by the mother. The baby should not be separate from the mother. That is called as rooming in. How to maintain the temperature in the sense you go for the next level, establishment of open airway and circulation. How to majority of the babies cry at birth and take spontaneous respiration. When the head is delivered, birth attained immediately, and suction the secretions, white mucus from the face and mouth and nose. Have to clear the secretion, the baby have to take the breathe normally. That's why you have to provide by the secretion have to suctioning have to maintain with using of bulb syringe. The suction of the nose by using of bulb syringe, and keep the head slightly lower than the body, and position the baby on their back or title to the side, but not on their stomach. You have to position the baby after you have to maintaining the circulation, have to maintain the ABC of the baby. And importance of suction. Why you have to provide by the suction to the baby in the sense, you have to several natural mechanism help with this. It is as the fetal chest passes through the birth canal, it is compressed and squeezing excessive fluid out of the lungs prior to the baby taking the first breath. Why you have to suction immediately after birth? The baby or head has enter into the external environment. You have to immediately suction the baby. Why in the sense baby has to take a first breath in freely. You have to take the squeezing of excessive fluid in the sense baby has to breathe easy, and you have to first breathe also precious breath of the baby. That's why you have to suction is important to the immediate newborn care. After several seconds in this partially delivered, a position fluid can be seen steaming out of the baby's nose and mouth. The identification of newborn. How to identify the newborn in the sense, before a baby leave the delivery area, identification bracelets with identical numbers are placed on the baby and mouth. Mothers. Babies often have two on the wrist and ankle. In the sense you have to provide by the identification tag. In the sense you have to provide by the tag by one hand, or you have to comes under by the one leg. In this identification card you have to mention by the baby of X have to comes under by the how many kgs, and when the baby is delivered, when the time has to deliver, which place have to deliver, the baby condition after birth, the baby condition have to mention by the ID tag. The vitamin K prophylaxis. Why you have to provide by the vitamin K prophylaxis in the sense it is comes under by the anticoagulant. The anticoagulant in the sense you have to hemorrhage during the neonatal period. A hemorrhage may have to take place. You have to prevent the hemorrhage. You have to provide by the vitamin K prophylaxis. The vitamin K prevent the neonatal hemorrhage during the first few days of life before infant is able to produce the vitamin K administration. The term infant in the sense you have to administer 1 mg IM vitamin K have to administer, and preterm infant in the sense 0.5 mg IM have to administer. And the initiation of breastfeeding, why have to initiate the breastfeeding? In the sense, the exclusive breastfeeding the baby is getting, in the sense the baby has to healthy and have to comes under by the external environment, also have to positive way to approach the baby. The babies can be breastfeed as soon as air is cleared and they are breathing normally. The daily care of the newborn. After immediate newborn care, you have to maintain by the daily care of the newborn. In this daily care, you have to provide by the during the newborn stage, you have to 24 hours within the 7 days, you have to provide by the daily care, and you have to complicated by the normal newborn may occur during the first 24 hours of days. The majority of complication of the normal newborn may occur during the first 24 hours or within the 7 days. So close observation and daily essential routine care is important to healthy and survival of the newborn baby. The essential newborn care, in the sense you have to provide. Why you have to provide? In the sense you have to more safe and more secure of the baby in the particular time. That's why you have to provide by the daily care of the newborn. The daily care of the newborn is under warm the baby and exclusive breastfeeding to the baby. Skin care and baby bath have to provide. You have to maintain the skin and care of the umbilical cord, and you have to care of the eyes and clothing of the baby have to maintain. And you have to most and precious momentous you have to administer by the immunization and follow up the advice. You have to provide by the general care of the baby, and you have to close observation of the baby. Because why you have to observe the baby? In the sense baby should not tell about I'm having pain, I am having irritating, in the sense not have to tell. You have to close observation, have to maintain what the baby has to occur by the some of the cause. And taking the anthropometric measurement, if the have to take the weight and height, and have to check the head circumference, have to check the you have to check the chest circumference. In the sense you have to go for the anthropometric measurement. You have to assist when the baby weight is increased or decreased. Even the head circumference, chest circumference is normal or abnormal, you have to assist by the anthropometric measurement. First one is you have to come under by the warmth. Why you have to provide by the warmth? In the sense you have to wrapping the baby with adequate clothing and the 2 layers. Ensuring the head and extremities are well covered. The baby should kept by the side of the mother. In the sense you have to maintain not only by mummifying the baby is not by the maintaining the warmth. You have to also have to baby have to kept with the mother. That is also have to warm the baby. And breastfeeding. The baby should be put to the mother a breast within a half an hour of birth, or as soon as possible the mother has recovered from the excretion of labor. I already said first breastfeeding is a most important in the baby life. You have to provide after birth of within a half an hour, have to provide by the breastfeeding to the baby. A skin and baby bath. The skin and baby bath, in the sense you have to provide by the skin should be cleaned of blood, mucus and meconium by gently wiping before he or she is presented to the mother. In the sense you have to after delivery baby has to have to occurred by the vernix gaseosa, or have to comes under by the any blood accumulation have to presented by this baby body proportion. You have to first clear the mucus and blood and meconium. You have to gently wiping, you have to present to the mother. And baby bath can be given at the hospital or home by using the warm water in warm rooming gently, and you have to quickly. The baby has to when you have to provide by the baby bath, in the sense baby have to adapt to the external environmental temperature. The baby is adapted to the external environment. How you have to assist by the babies comes under by the external environment. In the sense baby has have to comes under by the within a birth of 38 weeks to 40 weeks. The baby weight is 2.5 to 3.5 is normal baby weight. Has comes under by the babies after birth. Apgar score is 8 by 10 and 9 by 10 have to achieve. In the same, that is a normal baby. Have to provide by the skin and baby bath. And you have to first bath, in the sense once a baby temperature is stabilized, the first bath can be given. And cord blood collection. The cord blood collection. Why have to make sure cord blood is collected from the analyzers and sent to laboratory for checking of RH blood typing and hematocrit and possible cord blood gas. You have to assess by the cord blood collection. And care of the umbilical cord, in the sense keep the cord stem clean and dry, and topical application of antiseptic is usually not necessary unless the baby is living in a highly contaminated area. A care of eyes, in the sense you have to eyes should be clean at birth once and every day using the sterile cotton swabs and soak in the sterile water or normal saline. You have to separate swabs for the each eyes. You have to clear by the inner canthus to outer canthus. You have to clear the eyes by using of cotton swabs. And clothing of the baby, in the sense you have to, baby should be dressed with loosened cloth and soft cloth and cotton cloth. You have to provide. If in case of the fork should open in the front of the back or easy wearing of the cloth, I have to provide it. Large button and synthetic frock and plastic or nylon napkin should be avoided by the clothing of the baby. And the general care you have to provide. The mother is always rooming in the baby, and gentle approach of the mother as well the baby. And aseptic techniques have to used. With using of baby techniques, you have to wash the hands, and you have to taking care of the baby, you have to maintaining the aseptic techniques. And sensory stimulation have to maintain, and tender and loving care have to provided by the baby. The follow-up, each infant should be followed up at least once every month for first 3 months, and subsequently 3 months interval till 1 year of age you have to given by the follow-up. The maintenance of records and reports, in the sense here after delivery you have to, some of the records under have to maintain by the newborn. The assessment of neonates is done at the birth. You have to check by the assessment chart, and normal characteristics including the vital signs, intake output chart you have to maintain by the vital sign chart, as well the baby has to how much feed have to taken, how much excretion have to given, in the sense you have to maintain by the intake and output chart. Any problem during the breastfeeding is reported to adequate measure to be taken to the correct that. In the hence any problem during the breastfeeding, in the sense if the mother is getting cracked nipple or sore nipple, if the baby is not sucking properly, in the sense that is the has comes under by the problem. You have to notice that, you have to clarify the some of the advice have to provided by the correct way. The immunization card is made for every baby, and immunization given at the baby should be recorded that every time. You have to initiate the mothers have to maintain by the immunization cards. That is also one report, and records have to maintain by the immediate newborn. And records maintenance, in the sense you have to maintain by the admission record and vital sign chart, intake and output chart, and feeding records. Nursing care plans has to maintain, and laboratory and diagnostic tests and reports have to maintain. And daily progress notes and discharge summary also have to maintain by the records maintenance. And so was you have to discuss about the essential newborn care. In this essential newborn care is very precious care of the newborn. You have to take care of the newborn and earlier. Thank you.